Welcome to the office.
Hi.
Hello, I'm Jorj.
Nice to meet you, Jorj.
Nice to meet you too.
How can I help you? Now, before we start, guys, we're here in Dubai. We're at Tadawi Hospital. And I've been here 6 months. And you're the first patient who's going to share their story with us. So it's kind of cool.
Cool.
Yeah.
I'm the first, yay, great.
Tell me, how can I help you? Why are you here?
Well, I have a lower back problem and middle back problem on the upper back and in the shoulder as well.
All right-sided?
All right-sided. So because I sleep probably on that side most of the time, so maybe it's all related.
When did it start?
Well, the whole thing started when my wife was leaving.
When she was?
She was going to California and put some heavy stuff on our thing. So something, when I opened the drawer, something fell down and hit my small toe, so it was broken. And then I walked a little bit awkward.
So you were compensating after?
Compensating.
Did
then
you
I
have
got,
a cast?
no, I didn't have a cast.
anything?
No, they just taped it. It was a small one, so
Okay.
I can't do anything on that one.
Number one is the hip.
The hip, then it came to the front, and then it also radiated into the back somehow. And since that time, I had a lot of physio, got MRI done in other hospital.
What did they tell you? What's your issue?
Well, they said nothing to be seen there, so it's the 3 last ones. There's no more disc in between, and the 4th one I think has a drop. So that was probably the drop.
So they found it at L4.
Yeah, L4. I think.
Okay. Right.
And yeah.
So why are you here?
Because it comes and goes and nothing helps actually.
Okay.
So, and sometimes, well, I'm a little bit stupid because it seems to be that I'm good, and then I play squash again, and then it's bad again. Then another round of physio, it gets better again, and then 2 weeks ago, again, I was in the gym. I was doing some leg exercises. Not good.
Okay, so you haven't really got an answer. What you've been doing is kind of juggling this.
Yes.
Right.
So I was doing a little bit of stretching exercises, the same things, the common stuff, same like that.
Okay. So we got the hip, we got the back, going into the back. Started as a big toe injury.
Small
Small toe injury. Started a compensation, went into the hip, went into the back. You're also feeling it in the neck.
Feeling a little bit in the neck, and then, as I say, so
Right
but shoulder, it's an on-off thing. It's a longer thing. So when I do push-ups, so it's hurting on that side. So it's difficult to press bench presses.
Okay. And you're playing squash how many times a week?
Well, until September, I was playing 4 times a week.
Okay, fair enough.
So since that time, maybe 3 times.
Okay.
After that, so I'm not in the squash operating.
You want to go
right
back?
now. I would love to, because it's good for my weight. So I don't do any sports and I gain weight quite easily. So I was doing, in my youth, I was doing judo on a quite high level in Germany. And that also caused a little bit of trouble at the end and the back. So I have not the most healthy techniques.
Okay.
So I think that's...
You had fun though, right?
Pardon?
You had fun though.
I had a lot of fun.
Okay. It looks like it in your spine. So
Oh yeah.
let's go over your x-rays. Let's go over your spine. This is you. This is a picture in time. Tells us how you've evolved from birth. We have 24 bones in the spine that move, 23 discs in between. Think of this as your 24-story building. In order to have a stable building, we need to have a level base and foundation, which is your sacrum and your pelvis. This is your side profile. On the side profile, we're looking at 3 main things. Number 1, we're looking at posture. Number 2, we're looking at curves. And number 3, we're looking at the disc spaces. Okay? So first thing I'd like to go over is actually this x-ray. The reason why, there's a lot of answers we're going to get here. Because what you were told, you said the last 3. Okay. Your your last three are right. Your last two, these two are fine. It's L5.
Mm-hmm.
All right, so let's talk about this x-ray first. And the first thing we want to talk about is the posture. When we're looking at the posture, we're running a posture line from the lowest lumbar, and we're running it straight up the spine, okay?
Mm-hmm.
And that line should bypass C7, the shoulders, which it kind of does. It should also bypass C2.
Mm-hmm.
What it shows us here on you, we have a slight anterior head carriage.
Mm-hmm.
Now, you're the engineer, so when we look at this degree, we can say modestly,
It's not a good thing of forces.
but modestly we'll say about a what, 8 to 10 degree anterior?
10 degrees.
10 degrees. For every 1 degree past neutral times 10 is what the lower cervical spine feels here.
Okay.
So in this posture, when you're sitting for a period of time, you're getting a lot of tension in the
Yes.
neck and shoulders. So
Correct.
part of that is your posture. But we're going to talk about where the posture comes from. Okay? All right. So posture wise, it's more in the neck. Curvature. You play poker?
No.
You got an almost poker spine. You have absolutely no curve in your low back.
Oh.
That's the issue.
Mm.
There's no curve. It's completely straight. So what ends up happening, because when we look at our curves, we have spinal defense mechanisms to protect our nervous system at all costs. The number one spinal defense mechanism is our curvature. 40 to 60 in the front, 60 in the back, 60 in the low back. That's our shock absorbing mechanism. If we have no curve
It goes through.
and it's like this,
Mm-hmm.
where do we feel it?
Yeah.
One example. Jogging, we feel it in our low back. It's because you have no curve. You get better, and then you're going to do all these activities with no curve in that spine.
Mm-hmm.
So the focus is going to be, after we go through it, we got to get that curve back, and I'll show you where and how. Okay?
Cool.
So let's continue. We have a little bit of anterior head carriage. I'm okay with it's slight, but it's still it's affecting you. Now let's go over your foundation, because this is now where we're going to get the answers.
Because always those muscles here are very stiff.
Correct. And the muscles are stiff because they're guarding. Basal metabolic rate. Without the curvature anterior head carriage, you're expending too much energy to just be.
Mm-hmm.
So we want to figure out that. Now let's get you some answers. Yeah, here's your tailbone. Yeah, that thing is wanting to fuse. There's still a little bit of disc there though.
Mm.
Okay, there's a callus formation in the front, but it's not starting at L5, sir. It's down in the basement.
Mm-hmm.
So when we look at this tailbone, you had multiple injuries, whether it was judo, whether it was before judo. I'm talking elementary,
Mm-hmm.
teenage, back in the day. So this should be a smooth curve. You can see a nub,
Mm-hmm.
more nub, and then we have a coccyx misalignment. So we got to figure out this part, okay?
Okay.
And once we figure out this part and stabilize the base and the foundation, then we can get to your L5.
Okay.
Okay? Now I'm going to come back to this in a second. I want to show you this. So when we look at this X-ray, we can see, let's draw some lines. It's not a lot, which is good, but we have a slight tilt to the right.
Yes.
But it's within limits.
Okay.
But where did it come from? Let's look at the tailbone. You see the sacrum? That line matches that line.
Okay.
Now, this tailbone is bent. Instead of being like this, it's like that.
Mm-hmm.
And that's what started the compensation, part one. Part two, we're looking at the pelvis. And if we measure the pelvis, we're going to measure the widths of the ilia. The bigger width is the IN ilium, or the AS, which is going to be the right side. And when we look at the obturator, this hole here is a little bit smaller than that hole, correct?
Mm-hmm.
Now, here's the interesting part. The issue is the right hip,
Mm-hmm.
okay? The right hip, follow. The right hip, we call it an ASIN ilium. It goes up,
Mm-hmm.
so this is down, and then it turns in, causing it to
Not
be
nicely aligned.
okay.
Yeah.
But here's the thing: you have the short leg with it. Now, if I adjust the pelvis first, I'm going to make that worse.
Mm-hmm.
So that's not the answer, but we need to get to that at some point.
Okay.
We need to start on the tailbone.
Okay.
So I need to bring that tailbone up first on that right side, and then I can work on the hip. Does that make sense what I'm
Makes
saying?
sense,
Okay.
yeah.
I'm just talking mechanics.
Okay.
Okay. So
Follow that one.
exactly. The hips are still good. Hip sockets are good. This one is a little tiny bit less, but that's because you're favoring the right side.
Yeah.
Okay? So this is a tailbone case and then a right pelvis. Now, when I look at the shape of the disc in your L5, that's at least 30, 35 years ago. That didn't happen recently.
Yeah, that might be. Yeah.
Somewhere around there. That's good. A little less, but good. Those are fantastic. These discs are good. Now, you're starting to get calcification of the ALL, the ligament in the front. There's calcification there. There's stiffness.
Yeah.
It's this part of the spine.
Yes.
And the reason the body is laying calcium down is because of instability.
Okay.
We get you stable. I have a little nutritional trick I'll talk about later,
Mm-hmm.
and we'll help kind of resorb and break up some of that stuff for you, okay? These discs are all fantastic. These discs are great. I can't see that one there. These discs are great. This one is a little bit off, but overall, those are all good. I'm not worried about that. Now, you can see it a little bit more clear when I do it this way. So, the slight short leg on the right creates this curvature.
Mm-hmm.
The body then compensates,
Yeah.
goes back towards that way, keeps going. What is the body doing on this side? Laying down calcium. It's trying to stabilize because the body wants to tilt that way.
Mm-hmm.
Then it comes back again this way. And your digestion is off too. We need to talk about your digestion. Then it comes back this way, right? So all of this is all compensation, sir, to that foundation, that tailbone.
Okay.
That's where we're going to start. Does that make sense?
Makes sense.
Okay. All good talk until we get started. 1, 2, 3, 4, 5. Digestion. First thing I'm looking at. It's a German word, the Magenblase.
Mm-hmm.
The Magenblase should be a big black half circle there, sir.
Mm-hmm.
Here's a little tiny one, number 1. Okay? So that's number 1. As we're looking through here, if I change the contrast, okay, this x-ray was taken more for the bone, but I see a lot of undigested food going through your colon, especially when it gets to here. Do you get constipated? Does your
Normally
you have
not.
normal bone?
Normal bone.
Okay, well, it'll be interesting. You'll tell me after a couple of adjustments. I'm not going to give you anything then for the first 2 adjustments.
Okay.
Let's see what happens.
Cool.
Okay. And yes, we already talked about the disc. We know the disc is thinning out there. The goal is to keep movement. Questions on the x-rays?
No questions.
Okay, shall we get started?
Let's do it.
Starting at the base of the neck. And the first thing we're getting is C6, left side, 5 points. C1, right side, 5 points. Turn a little bit towards me there, sir. Perfect. Dun dun. Dun. There's T6, T7, 5 points, left side. And there it is. It's down in the basement. S4, S5, 5 points, left side. S4, S5, T6, T7, C6, and C1. Those are the major pressure readings we're getting for today. Next thing we're going to do is check the movement of your hips, okay? Feet together, open and close your knees with your feet touching. Open and close, open and close. Good. Right side only. Open and close. When he does the right, the whole left shifts because of fixation. Right side, so you can see the whole left shifts with it.
When I do it, I feel a little bit discomfort.
On the right or the left?
On the right.
Okay, now let's do the left side.
That's...
So when he does the left, this ain't moving. You feel that? Yeah. Okay. Right SI joint. Static palpation. Head down, sir. I may need to mess up a little bit of your beautiful hair. Dun, dun, dun. Static palpation. Now what's happening here, I'm feeling for the edema, swelling in the pit. And I can feel the pit starts on the right side there. You feel that one more or that one more?
No, the last one.
This,
yeah.
this one. 1, 2, 3, 4, 5, T6. That's the stomach button. Let's continue. Sit straight. Oh, we're gonna have fun, dude. Oh, we're gonna have some fun today.
Oh, shoot.
Oh, shoot. Vergnügen.
Oh, yeah.
Oh,
Oh, yeah.
okay, that's 5.
No, that's not good.
That's 1.
Oh.
That's 2. That's 3.
Oh, yeah.
That's 4.
Mamma mia.
That's 5.
5, okay.
5, yes?
Yeah, 5.
5 is okay?
No.
Now I'm going down low.
That hurts. Okay.
Now you see what I'm talking? It's down low.
Yeah.
So basement, foundation.
Has to be stable. Otherwise.
You've been talking about the first floor. The first floor is an issue, but we're not touching the first floor.
Yeah.
We gotta go submersible first.
Okay.
Relax there. I'm gonna hold a little bit of the hair. There we go. 6, 4, 3.
Whoa.
Oh. Sit back for me. Let's feel. Look up a little bit. Let me check, please. Passive motion. That's 1. That ain't moving, dude.
No.
C1, C6, T6, S5 Coccyx. Stand over here, please. We're gonna watch you walk. All right, walk to the corner of the room and back several times. Let's see the walk. Normal walking. That's your normal walk?
You say so. No,
Oh.
it's not normal walk because it hurts.
So you can see he's kind of compensating side to side the way he's walking. He doesn't have a very smooth walk at the moment. Why do you hold your right arm up like that when you walk? Do you know that?
I don't.
Is that the phone? I don't know.
Maybe.
Keep walking. Then you notice that he holds his right arm.
Yeah, look at that. Yeah.
You walk like this. Swing your arms. Swing your arms. Keep going. Turn around. Keep walking. Yeah, so you can see when he walks also on slightly on that outside right foot.
Yeah.
So he.
So I have insoles as well.
Okay. You can keep them for now. We're probably going to get rid of them in a little bit.
Oh, good.
Because what your body is innately doing, because the right hip is slightly lower, your foot is supinating in order to raise that hip up to give you balance.
Yeah.
So if we get that balance, it stops doing that, you don't need the inserts.
Does it give sometimes also instability whilst you're walking?
100%.
Sometimes I'm feeling that I'm a little bit out of slipping or something.
Exactly, and we'll see after the adjustment the difference, hopefully. Keep walking. One more time and then we'll see. You see that arm, right? This one stays in, this one goes out. Watch! You're gonna see it on camera. Ma'am, you see that?
Okay.
He's always been like that, or you don't recognize?
I didn't do very much, but for me, like, I change his shoes every 6 months because his shoes is just like,
Correct.
Yeah.
like
I'm gonna save you some money, okay?
oh.
So you're not gonna have to change your shoes
He's
up.
very low maintenance, guys.
You're low maintenance?
I'm forced
Come
to.
over here, have a seat, sir. Let's get started. Let's go over the game plan for today. We're gonna start in the penthouse.
Okay.
C1, just to get the messages down.
Okay.
Then we're gonna go down there. Oh, sorry, we'll go on the side, start on the S5 Coccyx.
Okay.
Then we'll go there, continue the S5 Coccyx.
Mhm.
Then I'll have you walk. Then we'll check T6 and the rest.
Okay.
Okay?
Cool.
Let's get started. Sit back for me. Relax the right ear. That's the home run.
Tief.
Wunderbar. Stand
Still
up and
alive?
walk it off once.
It's a little bit better on the top, but still on the back.
Okay. Let's go right side down over here, please. Coccyx S5. Relax the shoulder. Gotcha. Come up slowly, please. Walk it up.
Walk.
Walk. Feel a little bit.
Oi. Oi.
Oi. And we're gonna-
Oi. Ah. Ah.
Gotcha. That wasn't a German word, guys.
Oh no.
I'm gonna raise you up now, okay?
Okay.
All right, come off slowly.
Sleeping.
What's that?
I need that one for sleeping. Good.
There you go. Walk it up. Check it out.
A little better still.
Still.
There, I'm still sore. Especially when I turn. I feel
Keep walking, dude. Process. Okay. Let's go back down now.
Wait. Wait.
That
Oh,
one
that hurts, yeah.
or that one?
No, up. Yeah.
I'm gonna torque counterclockwise. Hold the feet. Nice and easy. Good. That's it. Gotcha. That's it.
Oi.
T6.
Oi.
Gotcha. German, you can handle it.
Oh yeah.
Okay.
Okay.
Keep walking. Ma'am, you see he is walking different, right? Mm-hmm.
The amount of collect you give to him. He has to.
That's it. That's it. Let's retest, okay?
Okay.
All right. Let's run the knee back. Let's retest. Head down. Starting at the base. C1 is clear. That cleared C6. T6 is clear. Tailbone is clear. Check this out. That's where we're going to start. Come back slowly towards me. That's your L5, sir.
Mm-hmm.
S1,
Much better.
S2,
Okay.
S3,
That still hurts.
S4,
Still hurts.
S5 is different though.
Yeah, different.
That's
Yeah,
what
not
I'm
not
saying.
that much. Yeah. Okay.
And that's the coccyx.
Okay.
Different?
Different.
Okay, now let's continue. All right, now, right shoulder, drop it down. Now let's do the machine. I'm going to be breaking up scar tissue. This is vibration therapy, 170 hertz to 180 hertz. Okay. That's the magic frequency to break up scar tissue. You'll feel certain areas have a little more tickly spice, and other areas just a buzz. That tickly spice is the scar tissue. That's what we have to fix. That's what we have to change through the posture. Okay? I'll give you homework in a little bit. back and work on your feet. Stand up, please.
Yes, I can lay down.
Oh!
You
You
know a
scored.
lot of bad points, huh?
I know a lot of good ones too. Madam, can you do me one favor?
Sure.
Can you uncrush your arms, please? It's an energy thing.
Ah, okay.
I talk a lot about it
Yeah.
for 7 years in
Yeah, I
video.
got it.
Thank you. Tell us, sound is the board, not your foot.
Okay. Wait. Wait. Oops. Oops.
Okay, stand up, please. And take your time.
Okay.
A little bit different.
Gets better.
Good.
Much better.
Stand over here, please. And let's walk a straight line again.
Okay.
Watch him walk now, dude. He got some swag back.
You see something?
Keep walking. Now,
Okay.
jokes aside, as you're walking, you tell us if anything is different. Doesn't matter good or bad.
It's easier to walk. Still, there's pain in the lower thing, but probably of the inflammation, I guess.
So the first thing I'm going to say is you're walking smoother.
It's feeling also a little bit more stable.
Your homework: 10,000 steps a day. I just need you to walk. We're gonna get you the yoga ball. Order a yoga ball. You're gonna sit and bounce on the yoga ball 5 minutes every morning, 5 minutes every night. We want to get motion in the spine. It's the best thing you're gonna do to get mobility there and to help get this curve back. Okay?
Okay.
Let's check the hands, sir. Come over here. Stand over here. Nope. Squeeze. Squeeze. This hand is good. Squeeze. Strong.
Judo. Oh.
Let it go.
Okay.
Face life. Turn and face this way. Ears. Okay. Back in the chair over here, please. Now, your homework, we say, is the walking. If you have access to a pool, get in a pool. Just get movement.
Okay.
The yoga ball is key to get the mobility.
Okay.
Okay?
So just bouncing.
Just sitting and bouncing. Just sitting and bouncing. There are other things I'm going to have you do later. I'll give you other homework probably towards the end of the week and before I go.
Okay.
But for right now, just movement. Okay?
Cool.
In terms of foods to maybe avoid this week or minimize, I say the red beef just for right now. I get a lot of people telling me, oh, so beef. No, just for right now. Goat, chicken, fish, lamb, all that's fine.
All good.
Okay, dairy, more in the milk. Cheese is okay right now. You like goat?
No milk?
If you can avoid it this week.
Okay.
If you can. Okay,
Okay.
if you can minimize it. The reason why,
I do it only normally in the coffee in the morning.
that's fine. Just to use a little bit though, right?
Yeah.
Replacing with cream is okay?
If you can use like a organic creamer right now, just for right now is okay. If you can switch to a non-dairy alternative just for the week. The reason why I say it, red meat, beef, dairy, specifically milk, and shellfish produce a lot of prostaglandin 2s, which promote inflammation in the body. I'm giving you something to reduce inflammation. If you're gonna eat that stuff right now,
It will balance out.
that's all.
Yeah.
So at least for this week, okay? So no milk, no shellfish, no
Okay.
beef.
Okay. Yogurt?
Fine.
Okay.
And you have all the options here.
Yeah.
Questions for me?
No questions.
Welcome to Tadawi.
Thank you.
You're welcome.
Does he need
Great
to
stuff.
change his pillows or anything with the mattress?
Okay, so let's talk about that. Good question. So if we look at your curve, if we look here, ideally we say high side of the rainbow up. So if we're looking at the curve in the low back, it's curved on the right.
Okay.
So you actually want to sleep on your left side
Okay.
to relieve your back.
Okay. So I'm sleeping normally on the right side. Yeah.
Okay, if you sleep on the right, that's better for your mid back, but it's not good for your low back. So one of the habit changes I recommend is to practice sleeping on your back.
Okay.
And the way to minimize the forces is knees bent with 2 pillows And either, if we look at your neck curve it's a little bit straight, but it's not reversed, so that's good. Use a small pillow or roll a towel.
Yeah, I have this, what's the thing?
The
This,
Tempur-Pedic?
yeah, something.
Yeah, that's fine. Use the small part though on your back.
Okay.
If you go to your side, use the thicker part.
Okay.
If you're sleeping on your side, regardless, we said the left side is better for your low back, right side is better for your mid. You want to put enough pillow, turn this way so I can show. You want to put enough pillow, so he needs about this much pillow, which will keep the head
Straight.
parallel to the mattress. If you're, pass me the spine model. If you're laying on your side of the bed, if you want to test it out, you can. Just have him lay on the side and shirt off so I can see the back. It's up to you if you want me to look at it. If there's more than a 19-degree arc in the spine, on the side, even with the pillow, change the mattress.
Okay.
Okay? There shouldn't be too much of a
Yes.
bend.
Okay.
And maybe for you, depending on your bed, if it's too firm, then maybe add a little latex topper to it if you don't already have it.
No, it's not firm. So we have
It's
a,
not,
we have a
it's
smooth
orthopedic
one.
actually.
Okay,
Yeah.
that's fine.
So should be only okay.
All right, so that's it for today.
Thank
It
you.
was a pleasure.
Thank you.
You're welcome.
Thank you.
Thanks, doctor. Nice meeting you.
Nice to meet you too.